Hello, Malcolm McCauley, physical therapist and developer of the LightSpeed Lift bodyweight support system designed to make movement easier for you. Today's tips and tricks topic is using the LightSpeed Lift for someone that has knee pain. And I'm going to talk specifically about total knees, but the big bugaboo problem that we see so many times is getting range of motion, getting back to normal gait after someone has had anterior cruciate ligament repair. Fairly common injury in the sporting world. Hear about them, people coming back. But a common problem that develops is people forget how to walk normally. When you've got an ACL injury, a ligament in your knee has been torn, and they've gone in and repaired that. A couple of different techniques, probably doesn't even remember or matter which technique they use, but the knee is sore. The muscles around there atrophy fairly quickly, but what they get good at is keeping that knee in a pretty rigid position. And bracing and words from therapists and doctors about protecting that knee reinforce that. Well, then 3 to 4 weeks later, that person begins therapy, begins some normalized gait, and all of a sudden that knee doesn't move. The connection from your brain down to your knee that says it's okay to bend just a little bit when you're taking a step somehow gets cut off. And so that person, it tends to be stuck hitching with their hip to get up versus taking a nice step. Well, what I found using the LightSpeed Lift is that when we support that person, lift up by 20 to even 35, 40 pounds, because on this particular injury, we do take a bit more weight off to start with. When that protection is provided by the outside force of the lift, it seems to remove that block between the brain and the knee and starts to allow easier motion at the knee, and the person, in effect, remembers how to walk. And that can progress all the way into remembering how to run, because getting back to a normal running speed after an ACL is extremely difficult. Strength comes along, mobility comes along, but that quickness, that ability to move your leg quickly, bend it, straighten it, and even start to do some cutting activities is what is oftentimes difficult to do. So I'm going to go through a quick little protocol where I set up the lift belt on. We'll get on the treadmill, start up the treadmill, and show you how I think it can progress very nicely and help shorten the time that it takes to get back to normal gait, remove some of those frustrations for trainers and therapists and clients alike, because everybody wants to get back to the quality of life. So here's putting on the lift belt. Around the waist, clip, and the belt simply holds everything in place. So this does not have to be tight. It doesn't bear any kind of weight. What we want to do is get these side straps aligned so that they're going down the center of the person's thigh on the outside. And we're going to then use 4-inch elastic wraps that are really designed to fit anybody's leg, which is nice. There's all kinds of adjustability here. So we take the bottom one first, set that down so that the strap comes out just above the patella, and snug that in. Second one then, again, is unhooking it, bring it around, and set. To one side, quick turn, straight down the lateral thigh, take the bottom strap, around the person's knee, hook, second strap, and set. Everything should be comfortable. We're not riding up into the groin. The major pull or catch He's on the quadricep muscles. And now we're ready to step up onto the treadmill and set the lift in place. So now I've got the client up on the treadmill. They're ready to go. The step to set the tension is to measure down from the bar down to the top of the strap, 12 to 14 inches. Now oftentimes for an ACL, if the person is sore, you don't want to be up maybe one more notch to get some extra weight, but it's really pain dependent and motion dependent. So the starting point is measure down from the eye bolt 12 inches to the top of the strap itself. That will give you 25 pounds and is a great starting point. Client can clip in the back straps, clip into the front straps, and at this point now, there is that 25 pounds of lift. There is a sense of balance from side to side. And the person generally will feel a good sense of relief because there's less pressure on that affected leg. And in this case, we're going to call that the left leg. And what you're trying to work on there is, can that person start to have the confidence to be able to bend the knee, motion that you know they have, and that is safe. And the straps will help that out and start to reconnect between the brain and the knee with less pain. The process it's helped immeasurably. Having worked with hundreds of clients over the years, just one of the biggest problems is to get that whole loosening up of the leg to start walking. And once clients get that, rehabilitation is speeded up immeasurably. So balance, taking little baby steps, and then ultimately starting up the treadmill to take them into a regular walk will help out the process of rehabilitating and getting them back to walking normally. So here's some interesting footage of a person who's got cerebral palsy on his left side, has pins in his left knee that have been there for 20 plus years. And so normal gait, moving his knee, has been difficult for him lifelong. And what you'll be able to watch here is as he cues in, as he knows he's fully supported by the system, he can start to get the feeling of bending the knee when he's taking a step versus peg-legging it through there. And there's some different cues that one can use. Can be hands-on, can be a verbal cue to march. It can be a cue to get his arms working in counter rotation so that his trunk is working differently. But it's a nice environment for Brandon to work on stepping, walking, and that then translates to real life. So lots of tips and tricks you can take away from this video. When you're done, client can easily, or the therapist can take off the straps. Maybe you want to give that sense with full gravity. But at this point, you've started to accomplish the goal, putting the idea back in the client's head that they're going to be able to walk normally again. They're going to be able to run. They're going to be able to return to their sport. And LightSpeed Lift, one of the great gifts that it has is that it gives back hope to people that, man, I just had a major injury. I had a surgery. I've got trauma to my leg, but I'm going to be able to do the things that I want to do again. So keep that tip in mind, utilizing LightSpeed Lift bodyweight support for people that have mobility problems. And this is talked primarily about ACL, but it would be total knee. It could be just a bad bruise. Using LightSpeed Lift to help regain normal mobility and get back to a better life. This week's tips and tricks, Malcolm McCauley, LightSpeed Lift. Like us, subscribe to the channel, and please send us any comments, more topics that you'd like to see in the future. Catch you again.